Good morning, everybody, and welcome to this webinar on driving innovation in healthcare with 5G and smart networks. We have an interesting lineup this morning with combining the perspectives of the healthcare sector with some senior surgeons and clinicians, and we also then will be bringing you insights from the industry and from SMEs and from research. So I would like to give a warm welcome to everybody, all of our panelists, and we'll introduce those in a minute. So here's just to give you then a quick overview of who is in the panel, and I'm just checking who's online with us. So this, just to give you some background, this is a webinar that is part of a series organized by 3 PPP market representation partners, and they are the 5G Infrastructure Association, which is one of the co-hosts of the webinar this morning. The other industry players are part of this group are the 5G Automotive Association, the 5G Alliance for Connected Industry and Automation, and the Public Safety Communication in Europe. And we're co-hosting this morning with NetWorld. So we have Professor Maziar Nekgovi, who is Vice Chair of NetWorld 2020, and their roadmap also in terms of research and development for 5G and beyond 5G and to smart networks. So on the panel this morning, we have Dr. Christoph Thümler from the Helios Klinikum Leipzig, and also a member of the 5G Health Association. Joining him will be Dr. Sabina Magalini, senior surgeon at the Gemelli University Hospital in Italy. And to give you a welcome this morning, we have Dr. Raffaele De Pepe, who is a board member of the 5G PPP and chair of the Task Force on Vertical Engagement in that public-private partnership. And then we'll be also talking to Julie from Huawei and his experiences in developing trials and pilots in the healthcare sector and what that means in the overall background. And then we'll also talk to Donald Morris from Redzing, an Irish SME, on their solutions and innovations. And then we'll move on to Professor Maziar Nekgovi as well. So I'll pass the floor to you, Raffaele, to give a warm welcome, and then we'll launch a quick poll for the audience. Thank you.
Okay, thank you, Stephanie. Okay, thank you for your nice introduction. I serve actually as a senior analyst in Telecom Italia Mobile in a department called Strategy, Business Development and Transformation Office. And I'm also a team representative on the boards of the 5G IA and NetWorld 2020. So I will like to give you a warm welcome from both of these organizations in this very interesting webinar that we will have today. I actually, in both organizations, I'm chairing a task force, a special task force on verticals. Since we believe that verticals will be the real players and the real actors for 5G in the next 5 years. I think that the vertical, the health sector is really in this moment a very, very important sector, not only from the societal point of view, but also from an economical point of view. According to a study of the European Commission, the 5G will create value in the health sector in an amount of 5.5 billion euros per annum in 2025. So 5G will create a huge economical benefit in the e-health sector that will be transmitted directly to the European GDP. But actually, the value of 5G and the e-health sector, which will be much more than this, through indirect transmission, through societal and political effects. Today, with the pandemics, we understand that public health is very interlinked with economical value, and we can estimate the impact of e-health sector through the huge economical loss that we are experiencing at this moment. Through the pandemics. So what I really believe is that the health sector today is crucial, and that the 5G is a strategic technology along with artificial intelligence to enhance the e-health sector. So I will give once again welcome to this webinar, and I give back the floor to Stephanie.
Yeah, thank you very much. I'll just stop sharing now because we'll launch our first poll. So here we go. It's a quick question. What do you see as the main barriers to 5G adoption in healthcare? This is a multiple choice question, but we'd like you to pick, please, your top two. So the options are, is it high investment costs? Is it lack of funding for pilots? Is it lack of government support? Is it due to privacy or security issues, strict regulations in the healthcare sector, or resistance from healthcare management and users, possibly due to a lack of understanding? And we hope to clarify some of the benefits and the value of 5G for healthcare. A lot of things that we can do already with 4G and previous generations, but there's still so much more that we can do with 5G. And I think at this critical moment in time, this is a really timely topic to be discussing in terms of how technology adoption and new ways of actually delivering healthcare is really important. So we're actually on just over 50% of the participants who voted. So we'll just give you another minute and then we'll start with the first presentations and discussions. So it is, in fact, the winner is the strict regulations in the healthcare sector, and then after that, privacy and security issues. So we'll be discussing all of these aspects in this webinar this morning and delve a little bit more deeply into what that means. And this would help us to shape future webinars because this is the first of a series dedicated to the healthcare sector. With no further ado, I'll now pass the floor to Dr. Christoph Thümler from the Elias Klinikum in Leipzig and member of the 5G Health Association, a very important initiative.
Okay, excellent. Thank you very much, Stephanie. So basically, thank you very much for inviting me, for having me. First of all, a quick disclaimer. So I'm working for Helios, but obviously whatever I tell you in this presentation are my own views. And also I have no financial interests whatsoever in this and no other interests. So this is for sole research purposes, what I'm telling you, and it's not necessarily related to the company I'm working for. Well, I'm based in Leipzig in Germany, and the hospital I'm working for has around 750 beds. So we're not small and not too big, somewhere in between. I'm running a care of the elderly department with currently, due to COVID, with 56 beds. They had to be reduced a little bit. And we have also 10 spaces for day hospital, which will reopen on the 1st of November. Just give you a quick overview so that you can understand where I'm coming from and can put that in the right context when I'm talking. So in the city of Leipzig, we have one of the largest care of the elderly departments. Helios as such, the wider company is running around 86 hospitals in Germany and various medical centers. And also we own Quirónsalud in Spain with 47 hospitals, 71 medical centers, and also a very large division which runs occupational health. In Colombia, we run 4 hospitals. So you see, Helios is not small when it comes to medical care. In fact, it's the largest provider of private care, if you want to name it this way, in Europe. This is a thing, you know, that was the past. Obviously, we heard it already in the introduction, it has changed. But I can tell you from experience, from years of experience, always when you spoke to the telcos or to the vendors of the technologies, and you were talking about 5G in healthcare, they would ask you, do you really need 5G for that? Can't you do that with 4G? And it was really an uphill struggle over the last years, you know, to get to the point, you know, that people understand that there is a huge space in healthcare for 5G. What is also very interesting, you know, when you see, and I'm always like to look into these annual Cisco reports, quite interesting, you know, that they show that, you know, 5G becomes more and more relevant, especially M2M is getting into the focus of 5G. When I look back 5 years in the early days, everybody was thinking about 5G major as an application for mobile phones and the next round of gaming device. But have always been convinced of the fact that machine to machine will be a real driver for 5G. And this is exactly one of the main drivers that I see in the healthcare environment. And this obviously also goes together with the idea of smart pharmaceuticals, asthma sprays that are linked with soft SIMs, and diabetes pens that are linked with soft SIMs. So all of these smart pharmaceuticals, they will be drivers for 5G, because the sheer amount of these devices, I mean, we're having hundreds of millions of patients with asthma and diabetes in the world. This would never work on the basis of 4G or 3G or 2G or whatever technology, because it's simply the sheer amount of devices, especially in the large cities. This would never work. So there will be health-related mass applications, and you can see just recently, you know, I mean, these apps have come under discussions because, you know, more and more people are convinced that they're not working very well. But, you know, let alone the functionality, but the sheer fact that due to an illness, namely COVID, people are all of a sudden using applications, hundreds of millions of people using these applications. You can see that mass applications in healthcare are the ones are going to drive this technology. In the same way as you look at it from the automotive sector, where you have a huge amount of potential applications for 5G. So basically, I think that 5G or healthcare is a big driver for 5G. Also because if you look at this slide, you know, these are, in my opinion, the main trends that we have been witnessing over the last years, and we will witness for the years to come. So on the one hand, we are moving from a hospital-based provider-centered healthcare to a distributed patient-centered care. I mean, most of the people that are looking at this now from the health industry, they will agree. 10, 15 years ago, people were not seeing this concept, and they were disputing that. So I think this is something which is very important. And on the other hand, you see that we will have these two forces, you know, real world patient care and virtual patient care that is shifting. So we have more and more virtual care and less real world care, because we simply do not have the resources anymore to move that forward in a real world setup. In other words, if, for example, if you look at the demographic development, if I want to treat millions of patients over 70 years of age, I would have to build a huge amount of hospitals, which no economy, especially now in crisis times, will be able to do. So these two trends, I think they will accelerate the spread of 5G or XG, you know, because we're already seeing the first 6G things coming up. And I'm a little bit skeptical, you know, because I think it should be like 3GPP, which never moved from 3GPP to 4GPP or 5GPP. We should simply, you know, it doesn't make sense if we have a confusion with new labels every now and then, you know, 6G, 7G, 8G is a little bit pointless. So I'm looking at things a little bit like XG rather than 5G at the moment. And you can see how Health 4.0 which is similar to Industry 4.0 or is simply a case of Industry 4.0, how that is going to drive different functions that we can currently see in 5G. So especially the massive machine type communication will be driven, you know, through basically for the 5G, and will propel 5G, 6G, 7G, 8G in order to enable Health 4.0 in our knowledge, basically similar to Industry 4.0. I think the current situation in healthcare, you can see that very well. You can see a lot of existing white papers. There's different white papers who have showed up over the last years, starting in the 2015 to 16 range. And I think the latest one is the white paper which we did in the 5G Health Association. It should be on the website relatively soon. And I think it gives you a little bit insight in the real world applications that we can see in eHealth. There's a lot of challenges that come along with 5G, and I think this is very important that we somehow tackle these challenges because they might interfere with the growth of 5G, 6G, 7G in healthcare. So there's a lot of information deficits. So people very frequently, because the people are working in healthcare, they're not engineers or physicians, you know, physicists. People in healthcare, they are people who are focusing on healthcare. So they know very little about radio access strategies or core 5G core networks, you know, they don't know that. So we need to inform them, and there is still not enough information. And on the other hand, which has really been a problem over the last couple of months, is all of these conspiracy theories that you get on the internet, people talking about the 5G weapon, and there is big concerns about all of that. And the people, they don't know about the radiation. When we're talking about frequencies and waves, some people mix that up with ionizing radiation. And I think this is very, very important that we distribute information, that we offer sources for neutral information where people can really rely on what we are saying. It needs to be something trustworthy, because otherwise 5G will suffer from that misinformation that we're seeing in the moment. You know, many people have privacy concerns. I think it is very important to address that, because 5G does not make a special case for privacy concerns. It is not different from 4G privacy concerns or from wireless privacy concerns. We simply need to address that. And I think very little is done in the moment to address these problems. Yeah. Then we have all of these geopolitical discussions that are going on and confusing people in the moment. You know, we have these discussions about Huawei, whether they can do something in America, and this is all stirred together with 5G, and this causes a lot of insecurity in people in general, and they don't know what that means and all of that. And there is some misunderstanding about data ownership. And also it is very important that we clarify these things. I give you here a slide. I don't know, Stephanie, if you distribute the slides later on. So for me, for my part, for my slides, please feel free to distribute them. There is nothing in there that is proprietary or that is in any way confidential. So I'm happy for people to have these slides. This is the webpage of the 5G Health Association, which we just put up here in Leipzig with a couple of colleagues. There's also members from university hospitals, for example, Charité in Berlin. We in Leipzig, of course, are members. Huawei has joined us in the Health Association, which I very much appreciate. And we are trying to form some kind of industrial network in order to be more concise about the information regarding the requirements of 5G in the health domain. And also to think about steps that we can take to better inform people than they are at the moment. There was the question, what we might be able to do to make 5G in healthcare a success. And with my final slide, I wanted to look a little bit at that, you know. So I think what is very important, and this I have to say, the 5G, PP, the whole public-private partnership, I think it was very important when the EC launched it. But we can say now that the support for the verticals was really falling very short. When we came to 5G PPP phase 2, it was already clear that what was intended as money to implement pilots and so on could not be spent because there were still issues open with regards to the basic technologies. So the decision was made to spend a lot of phase 2 again on the basic technologies, which is okay. And then when it came to the phase 3, they were all saying, okay, now the technology is finished and the verticals, they can have the technology development grants, which are funded with 80%, which is all nice and well. But I have to say, for most of the companies, especially under the current condition, this is simply not acceptable. And one, in my opinion, of the biggest blockages at this point in time is that we expect, especially the healthcare providers, which have no funding whatsoever for the implementation of these technologies, at least not in Europe, where there is very little private companies, you know, they will simply not be in the position to build up any kind of 5G infrastructure, even for testing, if this is not funded like any other research and development activity like these RIAs from the EC, meaning 100% plus 25% overhead. And this is what we need to get the pilots into the health domain. Any other idea, any other proposition will fail, because especially under the current pressures, the health industry does not have that money for that and will not spend it for that. I think it's important to drive cooperation on industrial level. I spoke about the 5G Health Association earlier on. It's an open association, so in principle, everybody can become a member. And please visit the website, and you see Thomas Neumuth, who is at Leipzig University, who is in the moment the speaker of the association, is happy to answer questions, or at least it's a good contact if you are interested in that. Another thing that is very important, the cooperation between the telcos and the verticals needs to go much better than it is in the moment. There is this issue, you know, who is doing what, and of course the telcos are totally right to say, well, we paid an awful lot of money for licenses, you know, and now we want to have some kind of right to provide the population with these technologies and so on. But I think it's a fact, and this is will be something which will not go away, that the industry has decided to introduce campus networks. And I think it's a very good thing that the industry is doing that. And I think this shall not prevent the telcos to develop further interest into these things. There is huge opportunity for cooperation, collaboration, and I think we at this point, you know, the cooperation between the industry and the telcos needs to be revisited and needs to become much closer and much better, because I think there is still space for endless business models that will help both the industry and the telcos. And as I said already before, establishing trusted sources for information is extremely important. It's vital, and we need to do that in order to get further. So with that, thank you very much for your attention, and I hand back to Stephanie.
Thank you very much, Christoph. In fact, I'd like to congratulate and applaud you on the foundation of the 5G Health Association. We know personally what a big challenge that was, and we're really looking forward to the new white paper that's coming out. And also, you know, I think one of the messages from your presentation this morning is how healthcare is changing and has to change to become more distributed, because ultimately it's about the well-being and the safety of patients, and we're living in very difficult and challenging times right now from that perspective. Raffaele, I think, has a question for you, if you'd like to ask to do that, make that.
Yeah, sure. Please.
Yes, my question was if he sees a kind of public-private partnership model in deploying 5G for the health sector. Do you think that there could be such a model which is independent from a private offering of 5G to hospitals?
Yeah, sure. I mean, absolutely. I see that, because there is so many areas where this is becoming relevant. Just as an example, I mean, by the end of the day, we are all looking towards network slicing and all the kind of applications that we can do with that. For example, the introduction of services. And I can imagine, for example, that the healthcare, the telcos, the telephone companies, that they are running more or less a catalogs where third parties are selling these services, and that we can then connect these services to the campus networks in the hospitals. Because yes, we want to and we need to purchase these kind of services, but what we need to do is we need to repackage the services. So we will not buy services and provide and pass these services on to every single patient, doctor, team in the house. But we would, for example, buy these services and then use our own core network in the campus network to repackage these. And we would then pass that on to the different interest groups, because obviously not every user has the same requirements, meaning patients will use different services from, example, doctors, surgeons, radiologists, and so forth. So I can think of a lot of models that we can use. And I think there is an excellent case to be made to basically consider another round of funding by the EC to trial these things. What is extremely important is that we are going to see calls, ideally already in the next year, where we really get these application research funding, and we can really put these projects, trials into place on the interface between vendors, telecom operators, and healthcare providers.
Thank you.
Yeah, thank you very much, Christoph. So now we'll move on then to another medical perspective with Dr. Sabina Magalini, Senior Surgeon at the Gemelli Hospital. Sabina, the floor is yours. Sabina is the coordinator of a research and innovation action called Panacea. This is pursuing a human-centric approach to cybersecurity in healthcare. So the floor is yours, Sabina. Thank you.
Hello, good morning to all of you. I have not prepared the slides because, as you will understand from the perspective of the hospital that I hope to give you in a sufficient manner, we are not so prepared to 5G. So it's difficult also to write down a statement. So let me introduce myself. I am a senior surgeon, meaning I will retire in 2 years, of this very big hospital, which is the Policlinico Gemelli of Rome. During the years, the senior staff has been more and more interested in medical management. You know, you go out of the wards, and so you take care more of the organizational problems. And so in this story, we had a great interest for cybersecurity in our hospital. And we managed to coordinate this project that's called Panacea, which started a year and a half ago in a completely different context than what we are living now. And so I thank you for the privilege of speaking on 5G. Much of this information I will be giving you was gathered for this meeting, because actually, you know, the operators on the field are not so interested, as the colleague before said, in this technology at the moment. So the perspective of my hospital is a very technical hospital. It's a big hospital. It's the second biggest in Italy. We have 1,400 beds. Every day, 30,000 people are going in and out of the hospital. We put up a COVID hospital in 7 days in March with 300 beds. And we've been using surgical robotics for over 7 years now, even though just the specialized surgeons that are doing particular types of operation. So if you see it from a hospital's perspective, we are used to thinking according to different lines of thought. We must distinguish between the infrastructure that we have and we can implement to adopt the 5G in our reality. Let me make an example. Like we are on a small hill on the outskirts of Rome. Even we are 11 floors of hospital with a lot of branches to our hospital, let's say. And even 4G does not work perfectly well in all our hospital. For the 5G, it is we are preparing one structure in one floor underground. Actually, to do that, we have to put up different signal repeaters in places to use this technology. So at the moment, we are just operating in this, we're putting up these repeaters in an operating ward underground, where we plan to use a new surgical robot for remote surgery, which a device manufacturer, and I can't tell you the name because they told me to be discreet on the name, confidential, has asked us to try and to validate in the near future. So we have seen at the moment that the investment costs are very high. They're not prohibitive, but anyway, for hospitals such as ours, which works in a private-public context, it is difficult to think of putting these repeaters, the network up inside the whole hospital. We could do like some pilots, some trials. At the moment, the situation is like this. If they decide to invest the mess money for healthcare in 5G technology, maybe it will be a good. The other issue to face is what kind of 5G devices and procedures they are offering us to use, okay? Because usually hospitals respond to a question, someone asks you to put up that kind of technology or that kind of procedure, and then you comply with that. For the moment, except for the remote surgical robotics, we have had no request. I mean, when you were speaking about the connected smart pharmaceuticals, you know, the things for the diabetic people and all the other connected devices. The hospital as a system has not been interested at the moment to this technology. We have had no request. But in a way, we like to think forward. So we think that maybe in a 4 years' time, we will be able to do some kind of 5G healthcare. So I just wanted to list to you some of the things that we think are top priorities for us, at least until we don't have offers from device manufacturers. Probably the first thing are the telehealth applications, in which the quality of experience guaranteed by 5G is the important asset. The plan is to dedicate a major attention towards the delivery of consultations on the side of the hospital, doctors and all the staff, because this is also an economic incentive. You know, with telehealth, one of the problems is also that we're having problems in accounting for the medical visits, because in the COVID pandemic, okay, everyone set up telehealth platforms that somehow to help the patients that used to come to our hospital, but often there are no accounting mechanisms to have them pay for the procedure. And unfortunately, you can't go on if no one is paying you. So that is a major problem in applying telehealth to hospitals, at least. Another function that we plan to explore, and we think is very important, is what we call protected discharge, meaning the possibility of discharging a patient from a ward or a hospital when he or she is sufficiently well to go home, but still needs some kind of assistance that they usually, at least in Italy, they request from the hospital. These people do not want to go out of the hospital. There's a big resistance to being discharged. So if we offered them the possibility to have real-time and face-to-face contact with the doctors and that are treating them, the surgeon that operated them, the doctor who treated them, especially the patients that come in for emergency conditions, because elective surgery is a little bit different. There's more confidence between the operator and the patient. So in this way, we could give them major confidence, and they would at least solve some of the problems of discharge and of hospital beds. Another offer that we have had, and this I let you think about it because we haven't considered it yet, is the problem of corporate wellness. There are some industries, big companies that want to give insurance to their the people that their employees, and they want like a contact with them directly and the hospital structure. And here they told us about 5G being something that might be important, with their wearables, if they have wearable devices. But also this is a theme to explore. Where personally, because here we have not only a hospital, but we also have an academia where we're doing research on the application of artificial intelligence, on which obviously we're pointing very much on this. So a major employment of 5G in the hospital setting is when we will be able to integrate all the artificial intelligence solutions that we are developing in various medical sectors. But these are, like many are in development, they're not ready yet. One of the problems when you get offers from medical device providers is that the AI solutions are given as a top-down procedures, and the medical side, there is a resistance against this type of assisted thinking. You say, why do I need artificial intelligence? After all, I'm a trained doctor. I don't need these procedures. So many medical and healthcare professionals are not able to understand yet the great breakthrough of the applications of artificial intelligence solutions and consequently 5G, because without 5G, it's very difficult to bring them on. So one of the policies that could be done is to have a more bottom-up approach, listening to the problems of the health professionals. That would be a better incentive also to research and the adoptions of these solutions. That is another point I wanted to make. One point, one field instead, where there is a great push towards the 5G communication is the mobile health. Connected ambulance, emergency assistance on the field, as someone will be speaking about now. Emergency medical services, meaning ambulances and their connection to emergency departments, and also crisis managers have always had a need to communicate rapidly and efficiently. So if you're looking for someone who knows telecommunication well, those are health professionals that are ready to adopt the solutions proposed. Also because they have also through European projects participated to the development of these procedures. And I'm convinced they will be the first to adopt 5G solutions, but that is something that is outside of the hospital, not inside. For what require is the issue of managing the hospitals and the wards. The problem is to put up the network, as has been previously said, the signal repeaters that we have not even thought of putting them up in all the hospital and the wards. So another solution that we have a big ICT group, is that when we were speaking together, we were thinking that 5G maybe can give a possibility of resilience to a hospital. Because, for example, let's say you think that the ICT system, let's hope never anyway, goes down in all the hospital. From the peripheral instruments, we could somehow rebuild or use the system. I can't be more specific on this because I'm not an ICT person, but they saw it as one of the systems that could help the resilience. And the security concerns were the last point we wanted to say. From the security point of view, we do not have so many concerns. I don't believe the 5G will pose problems over those that we already have in terms of GDPR. Once the NIS directive will be adopted and implemented in hospitals all around Europe, because if we do not have that implemented, and we are in a moment now in which they're asking us in 2 months to comply with the NIS directive under the COVID crisis, it's something that's really, really crazy. Anyway, if we were to have a problem for every medical device that we connect in the future, we would be paralyzed. So if security by design is guaranteed, I don't believe that the 5G will bring excessive concerns on cybersecurity to hospitals. So I am like ashamed of saying that healthcare in a big hospital is lagging behind, even though not on research at the moment, which is, we are like inadequate because we do not have upgraded healthcare structure. Also, the awareness of the single doctors is not so high. And also, it's difficult to change the mindsets. As you know, we already are going through this crisis. It's difficult to understand that you can't touch anything there. Okay, but also, if you want to push a system which is not ready to adopt a more modern solution, it can be very difficult. I don't say all the conspiracy theories, that is too much, but also you have to consider that systems, especially when they have to make an investment, they're very resistant to new technologies. Just one word on the project that we are coordinating, Panacea. Stephanie, if you can put up our slide, which is on people-centric cybersecurity in the hospital. Among our various tools, we are proposing a nudging policy, which means that you make people do something that without forcing them, you convince them that that procedure is better. This has been considered a winning solution to ameliorate cybersecurity in hospitals, because one of the problems is the operators that are not secure in their behaviors. So maybe we could adopt this tool also to making people understand that 5G technologies are not so ominous. So I wish to invite you to visit our website, and I thank you very much for this opportunity.
Thank you very much, Sabina. That was really interesting to see, understand what the challenges are, of which there are many. And I think, the interactive discussions, we can delve in a little bit more deeply into this. But, it's interesting to understand your time frame or, adoption roadmap as a hospital and on 5G. And, it really makes us understand how long it can take before we actually get real adoption cases as well in some, in different hospitals, and based on, where they are and, what kind of funding context they belong to. I think Maziar has a question for you, so I'll pass the floor to him and then we'll move on to the next part of the webinar. Thank you, Maziar and Sabina.
Thank you very much, Sabina, and thank you, Stephanie. So you pointed out to the very interesting linkage between AI and 5G in the context of health and care. So in the UK, there's an initiative called HSX, looking at digital transformation of health, and they have quite an ambitious program on artificial intelligence. Do you think that the need for AI would be a driver to enable 5G and vice versa in the health sector?
I think it's absolutely, that is the point. You can't do good AI applications without 5G. I mean, AI relies very much on the algorithms you are deriving from the big data, and also the constant input and evolution of the systems. 5G is, it's like, I think it's married to AI in research and in healthcare.
Thank you. I'd love to further explore this.
Yes, in fact, you know, it is one of the topics that we would like to explore actually in the future. AI and edge computing, there are lots of applications across a really broad spectrum of industry verticals, and that's something that we can definitely consider doing in the future. Also from a standards perspective, because there's quite a lot actually happening already, especially through GPP, with whom we work quite closely as well. So, right, I'll just stop sharing.
Could I just ask,
yes?
Stephanie, could I just ask something?
Yes, of course you may, yes, off you go.
Sabina, I was just wondering, how is, from your point of view, the situation with EC funding and the upcoming framework? Do you think we will need more fully funded calls to implement 5G? Or do you think this will be something which will basically go on its own account without further input, or that this could be done with 80% funding calls and stuff?
Look, I will bring the experience of what we have gone through now. We need 100% funding. Otherwise, our hospitals will never listen to us. I had a very nice offer from a LIFE project, you know, the LIFE initiatives for critical infrastructures, on which the funding is, I think, 75%. We worked for 2 months after to put up the project with a different hospital. After that, the hospital management said, we cannot afford even that 25% that we would have justified with person months, and they said no go. So if you don't have 100% funding, especially for the infrastructures, the hospitals don't have money. They work with, on the limit of going under every few minutes. So this is mandatory, I think.
Yeah, I was quite hoping that you're saying that, because this is a message which we're trying to bring across to the EC. We have been trying to bring across that for years and years and years, because especially in the health domain, it is impossible to work on the basis of anything less than 100% funding, because it will be rejected by the management, and that for good reason. And I have to say this is the same here. We are doing projects at the moment that are funded from the state of Saxonia. It was extremely hard, almost impossible to get them through, because they're only 80% funded. And it was an exception, because there were other negotiations then made with the government, and we could eventually get this project and move on. But we would not be able to do that one more time. So I think this is very, very important, that the implementation of 5G in the health domain can only thrive if there is 100% funding available to get things started, especially in the light of Corona, which will continue for another couple of months at least. And I don't think that we actually have that time to waste,
Yeah, I would definitely agree with that 100%. I think it's a really important message to convey, through this webinar and other forums, obviously, because, we really need to look at the major societal benefits that we can bring to the sector, and, really look after those patients. So thank you very much to Sabine and Christoph, and Maziar also for your question. I'm going to stop sharing now, so I can pass the floor to Louis from Huawei. He's going to be talking about some of the work that they've been doing in to drive innovation in the sector. So you can share your slides now. Okay, Ju, are you with us?
Yes? Yeah, many thanks.
Hello.
Yeah, hello.
Hello.
Yeah, Stephanie. Yeah, thank you. Wait a minute, I'll share my screen. I'm Julio from Huawei, and currently I'm working in 3GPP coordination department, which focus on to drive 5G technologies into reality. And I used to work responsible for the small cell, and also for the wireless research. So I understand the front end technology. So first, I would like to say that health is standing for the future, the mobile health, one of the top vertical markets for 5G and B5G. So if you check for China, last year during Mobile World Congress, CAICT, this department standing for China government to push 5G technologies into vertical industry. And the deputy president, they declare e-health is one of the top 3 of the vertical market. Okay, this is very clear message from China. And also in Europe, I already hear lots of discussion about Europe Commission, funding. But if you check, for Horizon Europe, for next 7 years, this next research and innovation framework program, if you check Pillar 2, health is the first, for global challenges and Europe industry competitiveness. And the total investment is 100 billion research innovation. So I'm not sure how much money would allocate it to health, but definitely it's a very, good, information. And if you check USA, it's more interesting. They issue a white paper about 6G, May this year. And in this white paper, they give some technology and application directions. And the healthcare and agriculture is key directions. So you see, China, Europe, and the USA all put health as a major vertical market, not only for 5G, but also for P5G or 6G. Of course, the generation names doesn't matter, but definitely the ICT technology should merge with the health industry. This is important, information from the government and policy. And if we are talking about then where we could start from, we could start from 3 top use cases. The first one is ICT and tracing inside hospital. Inside hospital is most important. The second is for personal area. It's AI plus wearable sensors and also early diagnose. The third is home. Home is very important. It could, decrease the burden from the hospital and settle lots of, problem. Why I haven't include ambulance here? Why? Because for hospital, it's indoor. For home, it's indoor. For wireless, whenever you go to outdoor, it's rely on the base station size, rely on the, signal performance. So this sometimes is out of control, even very difficult for operator. But when it's come to indoor, the wireless performance is some kind, under control. And it's only depend on your investment. Only the investment could be guaranteed. You could guarantee all the performance of radio, but for outdoor, it still could not be guaranteed for the public, network. This is current situation. So let's jump into detail. We already, have long time cooperation with the hospital. If you check for 5G, of course, first for massive connections, you need to connect it, all the things, no matter big equipment or small sensors to the network. This is important. The first is connection. And for 5G, definitely, it could provide the capability to connect, all the things, together. The second is high throughput. This is not only for downlink, which means from network to your terminal to your equipment, but also for uplink. It could be several gigabytes, throughput. So this is much higher than 4G and, before. For accurate positioning, for 5G, everybody know, with the 3G, 4G, 5G, the bandwidth increases a lot. With higher bandwidth, the positioning accuracy could be more accurate and also low latency. I have to say, 5G network have all these capabilities, but all detailed parameters rely on the real system deployment. For example, whether the hospital could already have fiber, or whether you support, the fiber deployment. 5G is just a radio. It's a pipe, it's a channel. And behind it, you need to have the fixed network. You need to have your local, mobile edge computing network to keep the data locally. Also, you need to have your security, system, and you need to have your AI platform all supporting end-to-end system. This rely on the hospital working with operator, working with our vendors like Huawei, also maybe working with the security, providers and all other application, providers. This end-to-end partners working together is the key. There should be some project, or some platform to have all the parties sitting together and talking about next step. Without all these parties working very close together, just the 5G pure technology is very difficult to have, large-scale deployment. So we also trigger, inside China, we have specification for hospital network, construction. You see, based on 5G. This is issued in last year, October. This is just beginning, a good try. It's including all the hospitals, operators, vendors, research institute. But as I said, paper never work. You need to have concrete project to have all the part together. And again, who found it is a really a big, a problem. The experience from China, our local government and the central government have some fundings. So we could start from, trials to bring the parties together to check it. So hospital is very important where we start, from, because currently, not to say 5G, even IT, even the very simple Wi-Fi, very simple, computer IT may not be a very complete system inside the hospital. This is current situation. Okay, so second, we move to our personal area. For personal area, our wearable, our smartphone, and accessory are very, very important. So you see, we already, have the started the research and also provide the real products, from blood pressure from 2015, and then sleep staging, HRV stress detection. And currently, we cooperate with the hospital, the research institute, on the sleep apnea and the weight analysis, all these heart health, arrhythmia, all these, things. So when we, put all our parties together, from one side, we could have the latest innovation and the top academia, to our equipment. But not only that, with our equipment, these data, these analysis would help to accelerate all the research in academia. Again, all the partners have to work together. It's not a TV you buy and you use it, not in that way. You have to optimize by multi-size. As our vendor, we have to optimize, our, equipment, and the operator would also optimize their business model and the deployment strategy, and hospital, and all the, the new directions of academia, they need to have their vision. What would be the future? So if we back to the home, the last one, and to my understanding, is also, very important. The aging is a big problem for every country, around the world. And with the aging, the number dramatically increasing. The current system simply doesn't work. Only with home, healthcare environment, with the health monitor, you found, the problem much earlier, and it could also lower the threshold. The patient could leave the hospital much earlier. This could be, decrease hospital burden a lot. And we already see lots of small, equipments which could, apply to the home environment. But unfortunately, the system is not ready, which means with 5G technologies, of course, this is not very mature today, but it could be mature, very soon. The terminal with a unified, air interface could link all these small equipment to make it a whole system. And for old people, it's difficult for them to see, on the terminal, but it's very easy to project it to the TV screen or to the computer screen. And as I said, with the terminal, with the computer, you could have your home level, AI, which means you could keep all your data at your terminal, not distributed to the network, not distributed to the cloud. Keep all data at your home, at your terminal, and just upgrade your local AI algorithm. Your local algorithm, AI algorithm could be updated, when it's connected to the cloud. In this way, the home environment could be seamless, connected to your hospital and satisfy our, experts just said, for remote disease diagnosis, something like that. And also for the robot, it's a 30 millisecond, latency. And so all these requirements not out of today. They already have, when they have system level requirement, call part requirements, base station requirements, MEC requirements, so that the system, could work. So it's very important, for the government to help us to break, the boundary of the, the regulation blocking issues. And also we need the industry platform to work with 3GPP together to translate the system requirements into reality. And the requirements should standing for next, middle and long-term vision. Vision driven is important for the cellular network ICT, and vision driven is also important, for our health industry. Okay, thank you so much.
Yeah, thank you very much. Just to add, I mean, a lot of the work that we're doing around industry verticals is in fact done with the support and involvement of 3GPP, and as you showed, those two logos as well for the 5G ACIA and 5G AA, and one of the, along with Public Safety Communication Europe. So obviously they're, they're really important emergency services. And one of the things that we have been doing is to gathering common requirements across industry verticals. And you mentioned side link or device-to-device communications, and that's one of those common requirements across various vertical industries. So, this is something that we need to understand now in the context of Release 18 of what that might mean. But I would like to pass the floor then to John, because he has a question for you.
Yes, thanks. This is John from Trust IT. We do have a question from the audience that has turned out to be relevant to something you mentioned during your talk, and it'd be nice if you could come back to it and say a few words. The question is, 5G edge cloud computing on premises, like in your hospitals, could significantly improve the resilience of the hospital ICT systems, maximize bandwidth, provide real-time responsiveness, and even support federated AI between hospitals. Can you say some things about what approaches you are considering for this in your projects?
Thanks a lot, John, and thanks for this question. In fact, we already have several projects and some kind of pre-commercial in hospital to build the mobile edge computing platform right inside the hospital to keep all the data local. Well, meanwhile, we support with our latest AI algorithm. These are already, pre-commercial, and also with our small cell, the good coverage inside the hospital. And also in China, some hospitals are chain, work. So we need to have dedicated, linking among these hospitals to guarantee the data could be shared in the certain groups. Yeah, this is already, moving forward. Thanks.
Yeah, thank you. So my pleasure now then to pass the floor to Donald Morris, who is CEO of RedSync. And Donald's been involved in some of the very early pilots and trials in the sector through the 5G public-private partnership. So the floor is yours, Donald. Thank you very much.
Okay, thank you very much for the chance to present, and very nice to hear about all the other presenters and to see what they are thinking about 5G. So let me share my screen and get the slide deck working. I'm here in just outside 20 kilometers outside of Dublin. Thank you very much. So I'm going to talk to you about the 5G wearable video for paramedics in the 5G Heart project. So I'm Donal and I'm the CEO of RedZinc. We're a company in Dublin and we provide wearable video for paramedics and for doctors and nurses. The project that we're involved in is really a mixture of use cases looking at health, looking at transport, and looking at aquaculture. So fish farming and cars and health. And we've got 3 different clusters, one supporting each industry vertical. So I'm involved in the health cluster and working with Philips and Oslo University Hospital. And then there's infrastructure partners and research partners. So we're involved in the health cluster. And really what we're trying to do is to look at more efficient clinical processes, impact for improved patient pathways and outcome, reduced hospital expenditure, and then reduce the impact of geography and on the economy of the quality of health globally. So that's really what we're trying to do in the health impact. And then if you look specifically about our company and what we're trying to do, our product is Blue Eye, and we're looking at the challenges that we're trying to address. So if you look at the healthcare sector, there's a problem really. In the field, they're really using 2G equivalent technology for ambulances in the main operations. So they're using data services and voice services and very limited data services. So that means there's no visual access for the remote expert in the field. And everybody's using video now, we're using it here, but the professional ambulance services really are not equipped yet in the broad spectrum for video. That means there's a lack of information in the system, the healthcare system. That then means there's additional resources needed to provide the relevant levels of service coverage. And there can be delays and extra costs because of those resources requirements needed. So that's just taking an engineering look at it from the healthcare system. So what we have is a wearable video. So a live video camera can send video back to a senior doctor, senior medical expert, could be a more senior paramedic, could be an emergency doctor, and to get connection and to see what's happening. So the idea, you can see it here, the paramedic is wearing a video headset. He has a rugged smartphone with him, and he can send video today on 4G or Wi-Fi, and then can send it tomorrow as more 5G gets deployed and get the advantages of 5G. And we'll talk a bit about more of that later. And the idea is that there's a remote doctor who can help. They don't always need help, the paramedics, but sometimes it would be nice to get help. And in this situation, that they can achieve help from a buddy or from a more senior doctor. Now, this is the example that might happen in the UK and Ireland. All the different paramedic services in Europe have different models, different service models, different standard operating procedure. So this is just an example of a future pre-hospital paramedic practice that could be implemented in the UK and Ireland based on the UK and Ireland model. So the idea today is that you have triage and that you have a patient history assessment and physical and mental examinations. And then there's a decision to transport the patient to the hospital, and there can be a time taken for the treatment because of transport. And sometimes there can be a necessary conveyance because the paramedic wouldn't have the right information and there would be a duplication of care. So the future opportunity is to have paramedic to paramedic, doctor to paramedic discussion by the doctor being virtually present. By having a doctor, he can speak to the patient virtually, and they can jointly make a medical assessment. And that then can accelerate treatment, and also it can avoid unnecessary conveyance if they can do a treated scene and provide first aid directly. So that's the current practice and the future practice that could happen with this use case. So the basic platform is simply a lightweight video headset that's ergonomically designed for use in the field, and it connects with a 5G smartphone. The service delivery platform is then in the center, taking video from different applications, from clinic applications, from hands-free applications, from 112 caller applications. And in the middle, there's a service delivery platform, which can allow then accelerated decisions to be made in the hospital or in the call center. And that gives then benefits. Gives benefits of accelerated time to treatment, time to decision, increase the efficiency, improve the patient outcome, make it better, help save a life perhaps, and provide pre-hospital emergency department economic improvement. So some of the drivers, like camera performance today outstrips 4G capacity. There's constrained uplink bandwidth. Users expect a higher quality of images, and priority is needed for emergencies. So users expect a higher quality. So today you can have 320, 640, sometimes 1280 video, depending on the capacity you get. And with 5G, you can have the potential for up to 4K to get much more better definition. And with 4G and 5G, at 4G, everybody's packet is together. So if you're, say, just to give you an analogy, if you're a car on the road and the ambulance comes along, you move out of the way, or the ambulance can go in the bus lane. So everybody's traffic is together on 4G. But say somebody is watching, a child is watching, YouTube and cats on skateboards or something on YouTube, that's treated today in 4G the exact same way as a medical incident would be. So the medical traffic would receive the same priority. So the opportunity for 5G is really to differentiate. So the everyday internet traffic could be in one part of the network, and there could be a priority for an emergency traffic when it needs to come through. Just like today you have when the blue light vehicle comes behind you if you're driving on the road, they can go in the bus lane, or you can move out of the road and make some space for you. And that's what 5G has the potential to do. And then there's a question, can we improve triage and operational process? So there's different skill levels. There's paramedics in the field, there's community nurses in the field, there are remote doctors in the field. And then on the other side, there's emergency departments in the hospital, there's more senior doctors, there's call centers, there's different locations, there's on the road, in the home, in the local clinic. And the idea is, can we improve triage process? Can we make more collegiate support for remote workers? And can we improve the operational process so that the healthcare system becomes more efficient and society benefits because they get a better health outcome? So these are just some work that we've done in two pilots in Oslo and in Groningen. We did these on 4G because that was available. And I'll just show you the type of work that we're trying to do. So one use case was in Oslo. We looked at 4 different use cases: mass casualty supervisors, chronically ill children, cancer drug follow-up, and paramedic to paramedic for pain relief drug delivery. So that's a picture of what we were trying to do. On the left, you see a picture of one of our engineers with the wearable video, and there's a mannequin there who's ill. This was simulating the fentanyl delivery. So the scenario here is that it's a buddy paramedic, and he's looking for support from his other buddy who's in a different location, and single vehicle ambulances who are looking for support. And the idea here is that the paramedic is wearing the video camera, and a remote paramedic is able to help him for those 10 minutes when he needs help, whether it's delivering the drugs or what is the right thing to do. So it's peer-to-peer support, really, because 2 heads are always better than 1, and if you can do that in a tricky situation, it can be helpful to get a better outcome. And here's another scenario we did. We were looking at, this is a mannequin on the ground. The simulation was that the person had been injured in a fight with a baseball bat, and their lung had collapsed, and the paramedic now had to insert a needle. You can see on the right-hand picture, they're inserting a needle into the chest cavity. This is to enable the lungs to operate properly and release the pressure. So this is a tricky thing to do, and the scenario here is that if you had 2 people working on this, as the advanced paramedic arrives, he's on his own in a fast vehicle, but this is a critical thing to do. And if for those few minutes he can get extra support from a buddy who's somewhere else, just to talk things through as they do that procedure quite quickly, it can potentially help. And then the use case we did with the hospital and the ambulance service in Groningen was a burns use case. We looked at both an actor and a mannequin, and we had 4 different levels of burn severity. So the burn scenario was a patient on the left and the doctor is on the right, and they're using the wearable video to treat the patient, and the doctor is able to see remotely on the right-hand side what's happening and to participate. So the doctor is in a call center and the paramedics are out in the field. And the idea is that 5G can enable this with priority, with a really high quality of video, that much better than can be achieved in 4G. And there's the burn scenario again. In this scenario, we're looking inside this is the scenario here is where the burns victim has got some very severe smoke inhalation. The hot smoke has burned the windpipe, and they're looking inside the windpipe to see how to help the patient breathe with that device. So thanks to all the different partners in the project, Telenor, TNO, Philips, Oslo University Ambulance Service, and Groningen Ambulance Service, Ambulance or Groningen, for helping make this this first pilot. Our next steps are to deploy this now on 5G. The scenarios we've done already are on 4G, and the project is setting up the 5G network linked to both hospitals and the ambulance service, so that we can now go to the next stage and show that the baseline can be improved beyond the 4G capability with better video, better picture quality. So thank you very much, and happy to answer any questions that might come across.
Yes, that was very interesting. Thank you very much, Donald. Yes, and congratulations not only on your work in 5G Heart, but also in the work you did in SliceNet, which is a phase 2 project of the 5G PPP. I think John has a question actually related to a comment that you was making before.
Yeah, thanks. Donald, towards the end, you mentioned that you were setting up the 5G the network. I remember during the presentation of Liu Ju, he mentioned that when you're inside a hospital and inside the home, you have full control over the quality of your 5G, but that when you're outside, there's a danger of being dependent on the public network for providing sufficient 5G quality. So is this also a factor for your wearable technology that you're going to have to deal with?
Well, that's an opportunity really, is to use the capability of 5G to do 2 things: to give a priority on the network and to enable better uplink speed. So the networks are designed asymmetrically. They mostly have 90% of the resources are allocated in the downlink, and 10-15% are allocated in the uplink. But we want to use the uplink video. So really it's a case of being able to use 5G. That's static configurations of 4G, and the potential with 5G is to be able to dynamically allocate those resources just for that event, because a typical ambulance event is like for 10 minutes. So it's to be able to allocate that resource for that certain period of time. And that's the whole idea of slicing, to be able to allocate those resources. Okay, and with the Wi-Fi, of course, when you're inside, if you go inside somebody's house, you don't have their Wi-Fi password. So you can't really use the service on Wi-Fi. And it would be nice for the industry to come up with a way to do that, where that there would be a way to access on local in-house 5G devices that could be accessed by emergency service. It would be nice to find a way to do that. But mostly in the project, we're looking at deploying it on public 5G, based on the 5G base stations that have been put up by TNO in the Netherlands, and Vodafone, and also in Telenor in Oslo. I hope that answers your question, John. Thank you.
Yes, thanks very much. And very interesting about the fact that you can't really get inside of a house during an emergency and quickly hook up to their system.
Yeah, it's a big limitation. The way the industry designed kind of Wi-Fi based on a commodity product. So you just buy a $50 router or something, and you put it in your house and you get connected on, but it doesn't really think about the service. It's really thought about as a box, and that box gives access. But the whole idea of 5G is having managed services, and that gives a richer feature set. And that's what the telecoms industry can deliver beyond, say, plain old Wi-Fi.
Thanks.
Sure.
Yeah, thanks very much. Yeah, very interesting. Okay, so we'll move on then now to our final panelist, which, Professor Mazière Nekouvi from the University of Sussex, and then we'll start on the interactive discussions. So if we can stop sharing the screen, Donald, and we'll pass the floor to Mazière. Thank you. And he's also Vice Chair of NetWorld 2020, which is one of the co-hosts of this webinar.
Thank you very much. Stephanie, can you hear and see me all right?
We can see you, yes, and we can hear you, yes.
Excellent. Then I will also start sharing my slide deck. Good morning, and it's a pleasure. My name is Mazière Nekouvi, and I'm Vice Chair of NetWorld 2020 European Technology Platform in Communication Networks and Services. And it's a great pleasure to co-host this event together with 5G IA and 3GPP group. I'm also, together with Rafael, a co-chair of a newly established working group on enabling technologies for vertical ecosystem transformation. I'm delighted that this is also the first workshop among future workshops that we hope to organize with our colleagues. Today, however, I thought I will focus on a particular pilot project. I'm from University of Sussex in Brighton. You see a picture of Brighton behind you, which is a nice part of UK, very close to London. We had a recent pilot project on connected and intelligent care. And I thought it's useful to share with you some of the findings from our studies of care homes as part of this project. Just want to also acknowledge my colleagues from Sussex that were involved in this. Just briefly, also take this opportunity to advertise our new working group. NetWorld 2020 is a network that brings academia, industry, and SMEs together. We work very closely with 5G IA. We also look forward towards beyond 5G, 6G. And this particular working group, the focus is basically to focus on roadmaps, longer term requirements, both from the verticals and from the communication systems. Extend the discussion to global, as well as looking at sort of a more future requirements coming from verticals until say 2030, so midterm and long term, as well as focusing on technology enablers and disruptive business transformation. So I'm delighted to invite you all to join NetWorld 2020 and this working group. We just started, so we are very fresh. Now moving on, just want to say a little bit about the background and scope, why we choose to focus on the care sector in this particular projects. Well, these are some numbers from the UK, but generally, I think it's true in Europe and globally. So by 2040, 3 million people in the UK will be over 85. So that's quite a large number of people. And this is twice as many as today. So that's quite remarkable. Now, at the moment, there are about 20,000 care homes for 500,000 residents. So if you look at those numbers, that was in 2018. And the care homes in the UK are typically not very large, averaging about 20 residents. Now, obviously, we do consider assistive technology for people to live at home, but many elderly, there's things such as dementia and related, they really need care in care homes. So that was also one of our focuses. And because these numbers are quite large, the current system is no longer able to care for the emerging demand. Also, research by EU finds that number of care homes actually haven't increased, but in fact has been diminishing recently. So there's an increased demand, there's a diminishing supply, what to do? And therefore, we believe that there are opportunities to utilize new technologies, and these technologies should be co-created with the stakeholders, connected technologies, meaning 5G and IoT, as well as AI, to cope with rising challenges. And in particular, when it comes to reducing the cost of operations and improving the quality of care without having to increase the number of personnel on potential infrastructure. The aim of this pilot project, we really put that emphasis on co-creation to work with the stakeholders from the health and from the care sector, councils, as well as technology and economists, the challenges of care homes, and in particular focusing on dementia. We have a Center for Dementia at the University of Sussex, and explore how IoT, 5G, and AI technologies can be harnessed to improve care and introduce more efficient ways of working within the care homes. This is a pilot project going for a year. We have finished phase 1. Phase 2 was delayed due to the COVID. So I will be mainly providing information on phase 1. And the project involved myself from Center of Advanced Communication Technology as a technology advocate and expert in 5G and IoT, but also working closely with our Center for Social Work and Center for Dementia Studies from the medical school, as well as the Department of Management who brought bringing expertise on the economic side. This project also involved working with 6 private and publicly funded care homes in Sussex. As you can see from the picture, Sussex is a very pleasant and wonderful area in UK. It's very also popular part of it with elderly, and there are many care homes there. So we got 6 care homes, as well as 2 NHS trusts. We were also supported for this project by our industrial partners. So I acknowledge them, BT, Vodafone, Huawei, as well as 2 SMEs, Therapy, which is a Swiss, Italian-based SME, and Kinsit, which is a UK-based SME. So that was a sort of ecosystem for the project. Now, the aim was, and I come back here with this that Christoph mentioned, is that the knowledge transfer on 5G and IoT, that's already a starting point. So this interdisciplinary team, we had this challenge. New technologies investigate the existing technologies in the care homes. What is already available there through pilot study, through field study, and therefore gain a better understanding of the challenges, in particular for providing dementia, in particular in care homes, and then identify, based on this, what would require from 5G and IoT solutions to enable innovation. The way we went through about this, and I was delighted to work with our Department of Social Care and Business School, because they are expert in these areas. So our methodology was through interviews and technology observation. The interviews were carried out both on-site at care homes and off-site. And the questions we asked were, what are the existing technologies that are in place? What are the experience of these technologies? Are they working well, or are there issues? And what are the gaps to assist care staff or people with dementia? And we basically interviewed managers in 6 care homes. We also did observations, so technologists, together with someone from social care in our team, our research assistants and leaders, went to 6 care homes and observed the technologies that were there, asked questions. And then we basically looked at the result of these studies. Now, this is a table just summarizing the care homes that we consider. In choosing the care homes, we were very careful to have a sort of a heterogeneous number of care homes. So we had care homes which are privately owned, and care homes which are publicly owned. Care homes where the majority were dementia patients, but also those which were not. So basically, we looked at what is the number of patients with different things, and what are the existing technologies in each care home, such as media care, iPad sensor mats, RFID, virtual reality, and so on, and what are the connectivities and CCTV. And very interestingly also, and this was also discussed in the previous discussion, is that we also look at the building's infrastructure and how would impact the connectivity. Now, in the UK, there are a lot of buildings are kind of a care homes or Victorian or purpose built. And so the coverage is really an important issue and also a challenge we find. So this is summarizing what sort of technologies are available in terms of end user technologies at the care homes. So what obviously stick out is sensor mats. These are mats that are used to detect the movement of patients at night, especially dementia patients, and also possibility of falls. So there is a possibility of falls, and that will send an alarm to carers to basically respond to that. CCTV is in care homes. It's not very pervasive. Our studies, I will show that later, that privacy and non-intrusiveness is extremely important to care homes. And interestingly, we find also digital entertainment. So some of these care homes are already using VR and AR to offer either entertainment or potentially therapeutics to dementia patients, as well as mobile platforms, e-health, mobile e-health. These are mainly used to exchange and coordinate information between carers and operating management operations. Now, this is an example of, for example, the fall detection mats in care homes. This is a wired system, so you already see having a wireless technology replacing this is already a great improvement in order to be able to mentor patients' fall or movements at night. However, that wireless technology needs to be part of a larger integrated system, so can't be operating standalone. And this will also reduce administrative time of care recording if that is then connected to a AI engine within the care home that reduce the number of false alarms, for example, increase the efficiency in the care home. So we really need to focus on this sort of an integrated solution. Also, the other thing is that how, without having to increase the number of carers, one can actually increase the quality of life of, for example, patients with dementia and families. Obviously, due to the COVID, we already see a real urgent need, because patients were not able to be visited by families, of mobile technologies in order to enable engagement with family members and patients. Your connectivity platform, this has become a really big thing now because of COVID. But these need to be affordable and personalized and user-friendly, especially for dementia patients, to engage and use activities. So here we see the use of AR and VR, for example, but typically they need a carer to assist in this experience. So you need additional staff. But there's a great interest in using AR and VR and similar technology. So that could be a very important factor in sort of the use of 5G to enable this AR, VR experience, both for entertainment in care homes, as well as potentially in terms of therapeutic and cognitive solutions. Now, the other thing that we noted, and here 5G plays an important role in terms of being an integrator, that this is a carer in a care home, and she's carrying at least 3 different devices, 3 different platforms, and maybe with different connectivity, Wi-Fi, 4G, and so on. So here, if 5G could be an integrative technology to basically reduce this redundancies and also make things simpler and more user-friendly for carers. So a single platform that provides all these services, end device, as well as single connectivity to connect them. So in conclusion, what was the outcome and conclusions? Well, we need better design and particularly co-design technologies, so we can obviously bring 5G in, but the acceptance could be low due to two reasons. One is that the care homes already have invested in a number of technologies, so they want to this new technology just to enhance it rather than replace it, at least in a short time. And basically user-friendly for staff and patients. 5G in combination with IoT, so this combination of 5G and IoT is very important, would provide a faster and integrated network, which is capable of realizing real-time monitoring and also rapid response. And therefore that will reduce the need for on-site carers, so the operational cost, especially when it comes to dementia patients. Now, we found, at least in the UK, but I think that's quite general in Europe, both the patients, actually the staff and the family, they put real weight on their privacy and autonomy. So obviously cameras are very important, could be an important part of this package, but there's also great interest in technologies which are non-intrusive solutions, such as RF-based, for example, localization and monitoring, which provide privacy and autonomy while keeping also patients safe. So that's very important for acceptance. Now, finally, to conclude the phase 2 of our project, so due to COVID, we were delayed, and in that time, we provided through university face shields and masks produced by us to care homes. But now we are moving to the phase 2 of the project, which are now focusing on what was the impact of COVID-19. It really accelerated the need for digital solutions and make recommendations in terms of a 5G key technologies, which we can expect to reduce the social care potentially by a very significant amount in UK. So thank you very much for your attention, and I'm ready to take questions if time allows.
Yes, thank you very much, Maziar. That was very interesting. Just a really quick question, because we're like, you know, we like to move on to the interactive discussion, and before that, we'll just launch a very quick poll. But you know, what you've been through the lessons learned. What do you see? What are you expecting to be the outcomes of phase 2 of the project?
The phase 2, we're really going to make partners recommendation on what sort of 5G and IoT technology would fit best the requirements coming from the sort of care home, and also make more general recommendations towards adoption of 5G and IoT. As I mentioned to you, NHSX has a great program focusing on digital transformation of the health sector in UK. Now, interestingly, connectivity, so 5G IoT are not at the moment on that roadmap. So our ambition is also to be able to include 5G and IoT in future roadmap for NHSX.
Thank you very much. Yeah, we're looking forward to hearing about the outcomes of that, and we hope that, you know, the phase 2 can start in a safer environment for everybody, especially for the elderly people you're looking after, which is very important. So here we go. So this is the last. I'm going to allow the panelists to vote. So this question is about what the future webinars should focus on. So there you can see that we have as options. Should we focus our future webinars on research priorities, funding and investment priorities, and we've heard that there's some very important ones there. Implementing 5G in practice, should we look at regulatory issues, which we know is a big barrier, or should we focus on privacy and security issues? So I'll give you a little bit more time to cast your votes. So thank you for doing that. It's very important, because it really is, for us, it's really key that we know what you want us to focus on in the future, and we can sort of shape also the future of adoption. And we've seen today, you know, that it's not just about 5G and the benefits it will bring along with those challenges that we've been hearing about, but also about combining different technologies. So we've talked about artificial intelligence, edge computing, and now with Maziar IoT, and all of these will come together, you know, to make a better world, hopefully in the very near future. Okay, so we'll stop voting now, and here you can see I will share the results. So it's actually top came implementing 5G in practice. So that's an important one, but obviously there's not a lot of difference between them. So thank you again for voting. So right, we're going to have this interactive discussion now with all the panelists. So the first question would be to all of them, all of our wonderful panelists this morning. What can we learn from each other about the short-term priorities? So what should really be the priorities that we should be looking at in the near future? So we'll start with our first panelist, Christoph.
So basically, what I learned this morning was that there is a lot of activities actually going on, very important projects. I really liked Maziar's presentation of what they're doing in the UK with CARE, and also liked what I heard about the Italian hospital, and also, of course, the emergency physician or ambulance example that was told from Ireland. I think it is absolutely brilliant that these activities goes on, but I find it extremely important that those parties that do projects should exchange the information, should come together. And first of all, the 5G IA is a very important panel for that. And I think the short-term priority should be to really make sure that we repeat talking to each other in different settings, but we should definitely continue with this. Also what I learned is basically that almost everybody sees the necessity for more funding in order to get really 5G off the ground in the health domain. Only by creating infrastructure, dogmas, and standards, this will not work. So for me, it is really a huge priority to do whatever it takes to get these 5G projects, models off the ground and keep talking.
So we need a human-centric approach to the health sector. So in fact, with that, I'll pass the floor to Sabina. Sabina, what's your lesson learned from the webinar this morning?
Well, I learned many things as well about the possibilities that are there. And I also learned that it's very important to communicate, you know, to offer the big hospitals a reason to work together. It's always a question of, you know, offer, demand, and so in a way, if we are not prompted to adopt something and given some something that sustains us, like an economic investment, it's difficult, you know, in the roadmap to say that we are going to adopt those solutions for everyone. So I think there's a lot of policy that should go on there.
Okay, thank you very much. Julie, if you'd like to say a few things about the short-term priorities.
Yeah, thanks a lot, Stephanie, and thanks a lot for all the speakers. I've learned a lot, you know, this morning. And to my understanding, in the short term, it will be most important for, you know, all of us work together to clarify the priority of the scenario and the requirements. I mean, the requirements should not be very general. It will be dedicated scenarios, parameters, and what cost could be affordable. Then back to the number one feedback, how to funding it. Thank you all.
That's another big takeaway then on the funding and the role of governments and the European Commission. Donald, if you'd like to share your views. Thank you.
Yeah, so my takeaway really is that the engagement model is still missing. So there is a history in the telecoms industry of being a disconnect In the in the 4G world and in the broadband world, the over-the-top model kind of won out, and the telecoms providers missed out a bit. And the margins and the services were delivered by the by the over-the-top service model. And 5G has got the opportunity to do it differently. But I think the engagement model still needs work on. So by engagement model, I mean that the supply chain needs to have the tools to work. So I think the operators in 5G could think about an engagement model where there was APIs available to be able to acquire slicing, there's a governance model, a service model, all the things that can allow digital service providers to use the 5G infrastructure and to make end-to-end services work. So that's my suggestion, is that the industry looks to make that engagement model work through APIs and associated governance structures that work for the carriers and deliver the value to the end users. And I think that'll make a better supply chain. Thank you.
Yeah, thank you. Yes, thank you very much, Donald. Maziar, if you'd like to say a few words.
Sure. So, Stephanie, maybe I take the final bullet point. What about the priorities in the long term from research? I already pointed out to more shorter term. So, I mean, looking ahead, obviously, I think 5G will be very successful with verticals and also health ultimately. But when we look ahead, we have really great opportunities even further down in terms of what beyond 5G can offer to health and care, something such as we're talking about digital twins, but we can have digital models of humans in real time. That is going further, that will go beyond 5G, but we already have to start to think of this sort of a future possibilities in the context of 2025 to 2030.
Yes, indeed, because whatever generation we want to call it, if it's a Generation X, as Christoph has suggested, we do need to start that research in a timely fashion. And I agree. I like also, the points about the, 100% funding and giving the hospitals and the healthcare sector in general, the incentives that are key to, doing the trials and the pilots as well, and bringing in their requirements. And as Luju suggested, having some very dedicated scenarios as well, where we understand also the cost benefits and what's affordable and what's realistic. And also, as Donna was saying, change the engagement model as well, make sure that all of the sides on the supply chain and all of the potential of 5G becomes a really hot topic, and in a very positive sense, because it's really important that we do drive innovation for the benefit of everyone in society. Yeah. And we've seen this. Sabina and Christoph are seeing this still firsthand because they're on the front line. But I think everyone has a lesson learned from COVID-19, and that is the really absolutely fundamental importance of healthcare in today's society. I don't know if we've got any more concluding comments. It's just 2 minutes past 12 o'clock. We started a little bit later, so if there are any more comments from the panelists, please take the floor.
Yeah, just one question, or just one thing. Would it be possible to share the email address? Because I would be quite keen to get in touch with Sabina and have a discussion, about, obviously, we are both working in relatively big hospitals, have probably similar issues. And I don't know, maybe also from the other members, so that we could get in touch individually and exchange with regards to certain future collaborations, projects, or whatever.
Yeah, that's a very nice suggestion, Christoph. If Sabina wants to answer that.
Yes, sure. There's no problem. We can share your address.
Thank
There was
you.
something in the chat that just appeared on the IPR rights of the artificial intelligence, models. And I think that we forgot to mention this. If you read the last question, it's on who owns practically the solutions. And in this case, I think, you know, if you put together the research and the practical aspect of diffusing 5G, you have to consider this in one way. I think it's a big concept that we could deal with in a webinar. This is important.
Yeah, well, yeah, that is a really important point, actually. And we know that other verticals have also been having these discussions. And John, for example, knows a lot about this in the automotive sector, for example. So that's something that we could definitely explore in the future. Any other final comments? Yeah, John, yeah, go ahead if you want.
Yes, this is in fact, this week in the European Open Science Cloud Symposium, they have talked about this issue. And in fact, one of the stakeholder groups they're talking about is clinicians who are producing enormous amounts of data with their instruments that would be funneled certainly into healthcare, and people have to work out what the IPR, the ownership of this data is.
Yeah, exactly. Yeah.
Stephanie, if I may, I would like to just thank you. So I would like to thank Stephanie Park and also John from Trust IT for really a masterly planned and executed webinar, and you've been really a driving force behind this. So thank you very much.
Yeah, no, thank you to you, Mazia. Thank you. It's been wonderful working with you.
Thank you, Stephanie.
Yeah, you're welcome, Raphael. It's always good to work with you both. And we are actually, Trust IT is a member of NetWorld 2020 SME. So we are also there with you. We're a kind of a stakeholder there. But, you know, obviously the work that we do with the industry verticals. And I'd like to also say a special thank you to Christoph for his support in the past. And a big thank you to all our panelists this morning. You've done a wonderful job. Really insightful, and I think having this multi-stakeholder discussion is really important, and we hope to take this forward in the future. I'm just going to check there are some, oh yeah, there are some discussions in the chat, but we can yeah, so yes, we've got some really nice ones. Sorry, I couldn't see the chat before for some reason, but yeah, we'll hold the webinar so we can take notes from these points that have been raised in the chat. So thanks also to our participants for joining us, and you know, obviously from this interactive discussion that we're having through the platform, even if we're not actually speaking together, you know, it's really important. It shows that there's an engagement also from the participants and a big interest in the topic. So we're looking forward to our next webinar, which will start working on in the near future. We'll also be picking up with the webinars with 3GPP because we'll be looking at release 18 and taking stock a little bit of where we are with releases 16 and 17, and you know, looking at the challenges that they've been facing as a standards organization, having to work virtually, and they've been really snowed under by. It's amazing the amount of email exchanges and documents that have been produced since the beginning of the year. It's quite mind-blowing. So thank you also to the 3GPP, and thank you to all of the associations that we work with, the 5G Infrastructure Association, the 5G Alliance for Connected Industry and Automation, and the 5G Automotive Association, along with the Public Safety Communication Europe. So you'll be hearing from all of us. NetWorld 2020, Maziar, Raffaele, best of luck with the working group. We've got lots to think about, you know, and take away from this webinar. So we're looking forward to the next step. So thanks again, everybody.